We want to thank Joanne Siegel. Joanne Siegel is our community educator from Bergen County. Joanne and I partner together in the community to deliver free education programs. Joanne, I thank you so very much for being with us today. And Joanne, please
Well,
present
thank you
for
very
us.
much to Robin and Jennifer. I hope that you learn from this program. It's very inclusive of some wonderful detailed out information. So I would like to get started. And again, welcome. And just know that we're focusing through a very sensitive lens, looking at very sensitive circumstances and recognizing that everybody's in a different place. One person's behaviors and reactions may be different than someone else who may have the same form of dementia. So that's something to keep in mind. Now, today we will review the challenging behavioral aspects of Alzheimer's disease and also other forms of dementia and strategies to use to help address them. So by the end of today's program, you will be able to, there are three pieces here that you will be able to have hopefully a good, clear understanding and learn how to work with these different pieces. The first one is to identify common triggers for behaviors associated with dementia. Second, explain the process for assessing and identifying challenging behaviors. And lastly, to be able to list strategies to address some common dementia-related behaviors. And just keep in mind, you will notice that as I go through the curriculum, that all of the above mentioned will come up on an ongoing basis. So they're really an underlying foundation. Now, some of the most difficult behaviors for caregivers to understand and to address arise in the middle stage of the disease. This is where it starts to become more involved. Behavioral symptoms can be caused by physical discomfort, such as fatigue, hunger, thirst, constipation, full bladder, or an uncomfortable room temperature. Now, behaviors may also be triggered by overstimulation, sadness and loss, boredom, isolation, or changes in routine or living situation. So although the causes may be hard to sort out, it is definitely helpful to take the steps outlined in these next slides to understand and respond to the needs expressed throughout the behaviors. We will present an outline of steps to take and will then apply those steps to the most challenging behaviors that caregivers commonly face. I believe it would be the next slide here. Oh. Okay. Now, today we will explore how to understand and address common dementia-related behaviors by using this four-step process, which again will come up on an ongoing basis throughout this presentation. Number one, to detect and connect. Number two is to address physical needs first. Three is then address emotional needs. And lastly, reassess and plan for the next time. Next slide, please. Okay. Yeah, okay. Join the person in his or her reality by trying to see the world through his or her eyes. You want to understand the person's reality in context before intervening. Who, what, and where? When and how? What took place before, during, and after the behavior took place? You want to approach the person calmly and respectfully. It's very important to remember, please, that you're stepping into their reality and trying to work with that, because they are no longer stepping into your reality. So to detect and connect, which is the first step in understanding and addressing behaviors, it's to detect and connect by joining the person in his or her reality. This means seeing the world through his or her eyes, as I just explained to you, rather than your own. Now, when we remember that behavior is a form of communication, we know that if we could see the world through the eyes of the person with dementia, and if we experienced what they experience in the way they do, the behavior would make perfect sense. Since they are the ones with the disease, we can't expect them to accommodate our needs. Instead, we must try to enter their world, connect with them as they are, and do our best to try to decode what they're expressing. Now, sometimes we simply can't figure out where the behavior is coming from or what the person is communicating through the behavior. However, it is our job to make every attempt to understand the behavior before intervening so that we can know how to help. To understand the behavior, you want to start by doing some detective work. You want to try to determine the trigger for the behavior and ask yourself, who was present when it took place? What happened just before the behavior began? What were you doing just before the behavior began? And what happened immediately after the behavior took place? Next, where did the behavior take place? What was the person seeing, hearing, or touching? When does the behavior tend to occur? Is there a particular time of day, day when it takes place? How did you react? Connect with the person as you assess the situation. Approach the person with respect and treat him or her as you would like to be treated in the same situation. Keep in mind that they're people too, they're still very much a person, and it's very important to be respectful with them. Begin by coming to the person from the front and identify yourself if necessary. Move to his or her physical level and use eye contact and body language to convey a friendly approach. This is very comforting for the person, and the respect coupled with going down to the physical level and using eye contact, this is all very important. You want to make the person feel as comfortable and as safe as possible. So the person will respond much more to your tone and body language than your words. It's important to be kind and helpful, both in your language and your emotional state. You want to be language sensitive. You want to be careful with with the words that you employ, because you don't want to be hurtful or cause any upset. You want to show them the love and care that you have for the person. You want to address physical needs first. That includes medical issues, physical problems such as hunger or thirst, lack of social interaction, and environmental triggers for discomfort. Now, next we'll address the person's needs, starting with the following. You always want to begin by exploring any needs that may be related to physical pain or a medical condition. Consult a physician to identify causes related to medications or illness. Note any signs of injury due to incidents such as a recent fall, and consult the person's physician with any questions or concerns. Now, people with Alzheimer's disease often experience pain from undiagnosed urinary tract infections, compression, fractures, arthritis, poorly fitting dentures, indigestion, constipation, or other medical conditions. And in addition, behavior may change due to a reaction to a new medication or interaction between several medications. So their needs may not be recognized due to the person's inability to recognize or talk about his or her symptoms. And note any unusual behaviors or symptoms and report them promptly to the person's doctor to treat or rule out any medical causes of the person's pain. Keep in mind, sometimes if you are accompanying the person who who suffers from a form of dementia, you may want to reach out to the doctor and or his or her staff prior to going on the appointment, so that by the time the treating physician walks in the room, he or she has an idea of what has been happening at home and can be more sensitive and in how these matters are addressed versus saying it in front of the patient, which can become very upsetting, stressful, and confrontational. So you want to try to be very sensitive to that. And if it's possible, reach out to the doctor's office, whether they have a patient portal, an email, making a phone call, a fax, something to help them to have more of an understanding before they walk in the room. Second, you want to check for physical discomfort due to environmental issues, such as restrictive clothing, lighting problems or glare, or uncomfortable room temperature. And additional common causes of discomfort include hunger, thirst, the need to stretch and move, the need to use the bathroom, the room being too bright or being too dark, too noisy or too quiet, being in an uncomfortable position, or too much commotion. Now, adjust the environment as necessary to make the person more comfortable. During the physical assessment, continue to connect with the person and maintain a calm, soothing presence. This is particularly useful for helping the person with dementia to reduce any agitation or upset related to the pain. And very often, if the person is willing, hugs and pats are always a good way to help them to feel calm. Next, you want to address emotional needs, and that includes focus on the person's feelings, not the facts. Use your knowledge of the person's preferences to provide effective interventions and redirect the energy into a more soothing activity. You want to think about how the situation feels to the person. This is usually the basis for his or her behavioral reaction. And then focus on those feelings in your response instead of on the facts of the situation. So feelings are very, very important. You want to avoid correcting people if what they say is inaccurate, because remember that you are connecting with them where they are. Telling them that they are wrong will only escalate the situation and convey that you don't understand. And he or she will try harder to convince you and get even more upset. You want to let the person know that you are with him or her and that you are safe together. You want to reinforce that you're there to help and that you will try to make changes to make the person more comfortable. So although you may not understand the exact meaning of the person's message, you can usually identify the feeling behind the behavior. You want to address the emotion behind the behavior to help the person feel less overwhelmed and alone. And this will allow both of you to de-escalate the situation together. This is very important. You want to try to free up energy to direct elsewhere. And even if you're unable to understand what the person is trying to convey, he or she will know that you're trying, which may reduce frustration and anxiety, and they clearly understand that you really care. And finally, you want to help the person redirect some of the energy he or she is expressing through the behavior by leading him or her toward behavior that is something that is soothing and enjoyable. So it's very helpful sometimes if you can identify a hobby that can help to distract them from whatever they may be experiencing to help them calm down. Something to redirect them and make it more of a positive arena for them. Now, the final step in the process is to ask yourself whether your new response helped. Again, you go back to detecting and connecting, joining the person's reality. How does the situation look now to the person with dementia? Do you need to explore other potential causes and solutions? If so, well, what can you do differently? Now, once you've settled on interventions that are effective, recognize that this type of issue may arise again. So you want to plan to reassess at periodic intervals. And your intervention plan may include the following: how to recognize the signs of the issue return, how quickly you need to respond, what to try and in what order, how to assess for the effectiveness of your interventions, what to do if the situation escalates or your interventions are ineffective, and who can help you get the assistance that the person may need. Now, these steps can be applied to any behavior experienced by someone with dementia. Now we'll look at how the steps can be applied to some of the most common dementia-related behavior. Now,
she was part of the family. You know, she'd fold towels, and she'd fold towels all day long some days. Just, you know, put them back in the basket, and then she'd give them to her, here's some more towels. And it may sound like it's cruel, but look, it kept her busy. It kept her movements going. It kept her, you know, just kept her occupied, and it made her feel wanted and that she was contributing. We created a routine for her that worked for her around her agitation and, you know, her sleep patterns. So every day she was in the same routine for the most part, and every day she did something. She was always in the kitchen every day helping do something. Sometimes she'd rinse dishes, but she was always near the kitchen sink because she spent most of her life in front of the kitchen sink. Now she was just doing it in different ways. And yeah, going for a walk, going out in the car for a drive, walking around the yard, you know, watering plants. Those are all things that she did, and we just had her continue doing them.
So as you can see, Rose is explaining the value of trying to utilize hobbies or other methods that the person was used to having throughout their lives. That will be very helpful and a good support for them. Now, applying the steps when there's confusion or suspicion. When someone with Alzheimer's disease is confused, he or she may not recognize familiar people, places, or things. So when this confusion is accompanied by suspicion, the person may accuse others of stealing, of being unfaithful, and it can be very difficult for caregivers when the person cannot remember who that caregiver is or what the caregiver's character is like. So let's use the example of Anne, a woman living with Alzheimer's disease, as she begins to experience some confusion and suspicion. And then we'll explore how taking the 4 steps that we've already outlined can help. Now see if you can apply the steps to this vignette. When Anne's family comes to visit and evening begins, she becomes very suspicious that people are trying to get into her house and are watching her through the big picture windows. She becomes suspicious of her family for not making the people go away, and that they all must be in cahoots with each other. So, step 1 is to detect and connect. Try to stay calm as you explore. What is the confused or suspicious behavior? When is it happening? With whom? Where? And how does it manifest? You want to check the environment for potential sources of confusion. You want to try to discern whether the person is reaching to something in the present or is instead reacting to something imagined or in the past. If the trigger is current, explore how the person is interpreting the occurrence. For example, if the person has misplaced something, he or she may worry that it has been stolen. If the trigger is something imagined or in the past, see if you can understand what that situation meant to the person. You can offer corrections as gentle suggestions or answers. If you escalate your energy level, the person will match that and increase it even further. Now you want to show photos and other reminders to trigger the person's recognition of what may have happened. If items are lost and no one can find them, see if you can provide a solution by duplicating them or providing multiples of often used items. And remember that this is about diffusing the situation, not convincing the person of the truth, because if you try to do that, it can turn very confrontational and it's not a healthy circumstance when that happens. And very important to try to diffuse the situation and show the person that you are in their reality. You want to modify the environment if needed. You want to take down mirrors if they seem to be problematic. Upgrade the lighting is another example. And you want to respond with a brief and accurate explanation, but again, avoid arguing. And it's also helpful when you speak in the most simplistic terms to really try to ensure that the person understands what you're trying to convey to them. Now, step 2 is to address physical issues first. Rule out a medical explanation, such as infection, low blood sugar level, or delirium. And you want to assess for physical discomfort due to the environment, overstimulation, or maybe even fatigue. Next, you want to address the emotional needs. You briefly let the person know that you understand he or she is upset and in what ways. Let the person know that you will take care of the situation. Repeat this message to the person as he or she begins to calm down. You want to remember that you have entered the person's reality and let him or her know that you are here to help and are on his or her side. Agree, acknowledge that you understand, and apologize as needed. For example, I'm so sorry this is happening, Mom. Let's see what we can do to fix it. Try not to take the person's confusion or behavior personally. That's very, very important. This is difficult when you are the target of accusations, but remember, it's the disease that's causing the accusations, and they're not a reflection of the person's trust in you. It can be a very difficult time, and it really requires a lot of patience, and every day is acceptance with this. So you want to reassess and plan for next time. You want to ask yourself whether your new response helped. Do you need to explore other potential causes and solutions? If so, what can you do differently? If you can identify other approaches, try them out and continue to reassess throughout the process. Assume that the person will feel confused or suspicious again in the future, and you want to try to devise a plan for addressing that. Now, sometimes a person with Alzheimer's can experience aggressive behavior, which may be verbal, physical, or both. And there may be a trigger for the behavior that you can identify. But there are times when it may seem to appear for no reason. So let's take a look at Anne and Bill as they deal with incidents of Anne's aggressive behavior, and then we'll explore how taking the 4 steps we outlined can help. Remember, I explained to you early on that these steps would reflect on an ongoing basis throughout the presentation. So Anna's husband, Bill, is standing at the back of the room, leaning against the wall with his arms crossed, watching television. Anne walks in and tells him sharply, "You aren't the boss here." And Bill ignores the comment and continues to watch television. Anne comes closer, raises her voice, and says, "You can't tell me what to do." When Bill doesn't respond, Anne comes up to Bill and hits him on the arm with her balled fist. Prior to her dementia symptoms, Anne was quite calm by nature and would never have exhibited this behavior. Now, lately, her outbursts are becoming more frequent. She continues to come at Bill, who retreats from her and locks himself in the bathroom to avoid further conflict. He does not have a cell phone with him. So once again, you want to review these steps. Step 1, detect and connect. You want to try to identify the immediate trigger for the aggression. Did something frighten or alarm the person? This may not be a logical response, but rather an automatic reaction to something the person is perceiving. Ask yourself the who, what, when, where, and how questions to explore the situation. Gently say the person's name and let him or her know that you understand and are there to help before attempting to intervene. Apologize when it seems that it would help calm the person. You may be apologizing for something you didn't even do, but you know what? This apology is a reflection of the person's reality, not yours. You want to screen the environment for any obvious triggers, such as excess noise, changes to the usual schedule, or something the person may have perceived as a threat, and make any adjustments that you can make safely. Now, you want to address physical issues first. Rule out medical causes. Some people lash out when they're in pain. Limit or remove any distractions, and be sure to protect everyone involved so no one gets hurt. You may need to ask children to leave the room or ask for additional people to provide assistance. And part of your role here is to ensure everybody's safety. Next, you want to address emotional needs. You want to screen for emotional triggers. And people act aggressively when they perceive danger or are scared, surprised, alarmed, or in pain. You also want to be aware that some triggers that may not be directly clear to you. And you want to focus on feelings and not facts. Be positive and reassuring, and let the person know that you are there for him or her, and that you will stay to help work the situation out. Step 4 is to reassess and plan for the next time. So once you have settled on interventions that are effective in calming the person and reducing aggression, recognize that this type of behavior will probably return and may even increase in degree. Make a plan so that you can avoid being taken by surprise. Particularly with aggressive behavior, having a plan in place is crucial. So be sure to include what to do if the behavior escalates dramatically. And the best way to avoid a difficult or even dangerous situation is to take some steps to ensure safety, even before the first incident takes place. Now, these can include alerting neighbors about the person's condition and anticipated behaviors. If you have a positive relationship with local first responders, meaning the EMTs or maybe the police or the fire department, you can let them know about the person's diagnosis so that they can be prepared in the event of a call. Get rid of any guns that might be in the house. Even though there is no ammunition, if Anne appears to be threatening in public and is carrying a gun, police must assume that the gun is loaded and take appropriate action. This could have disastrous results. You want to consider a personal security alarm for accessing help when needed. Now, let's talk about repetition. saying something over and over, repeating words, questions, or behaviors. Let's take a look at Anne's repetitive behavior, and then we'll explore how taking the 4 steps we outlined can help. Repetition is common among those with dementia and can be very frustrating for caregivers. Avoid correcting or trying to convince the person of your viewpoint. Again, remember, you're in their reality now. And you want to remember that the person cannot remember asking the question earlier. So Anne has recently been concerned about an upcoming visit from her daughter. Now, although her daughter Katie is not scheduled to visit for another 2 weeks, Anne has begun to repeatedly ask her husband Bill when she will arrive. Anne asks several times throughout the day, every day, which has begun to wear on Bill. He finds himself answering impatiently or even ignoring Anne's questions. At the same time, Anne is going into the bathroom much more frequently than she ever has before, every 10 to 20 minutes. So let's keep Anne's situation in mind as we review these steps. I see first we have a video.
Repetition is really one of the most common and also frustrating behaviors for caregivers. It's important to really just take a minute, take a breath, and really think about how you could help that person with the answer that they're looking for. It really makes no sense to sort of bump heads with them and try to correct them or try to tell them to stop asking it, because they really can't remember that they just asked you that a minute ago. So thinking about how you could provide an answer that's reassuring, even though you might be doing it over and over and over again.
So as you can see, Dr. Fazio is saying repetition does come into play, and it's okay. It's what has to happen to try to help the person in understanding what's going on. And we can again review the steps. Step 1, again, to detect and connect. Stay calm and be patient. Use the who, what, where, when, how assessment to look for triggers and patterns. Accept the behavior rather than fighting to stop it. You'll need to work with the behavior rather than against it in order to intervene successfully. Step 2, address physical issues first. As always, look for pain first. Explore whether the person may be experiencing pain and make adjustments to safely alleviate the pain. You may even want to reach out to the person's treating physician, because sometimes when different medications are taken simultaneously, or if the person's not feeling well, these are definitely reasons that can trigger somebody's forgetfulness and confusion. So you want to really have that monitored closely, just to be clear as to where it's coming from. Is the dementia progressing, or is there something else going on internally? Now you want to explore the physical environment for triggers and make any needed changes. And as I just mentioned, call on medical professions to assist if the behavior change took place suddenly. The behaviors you see may be the result of an infection, such as a urinary tract infection, another medical issue, or a medication side effect. Step 3 is that to then address the emotional needs. Focus on the emotion that the person is exhibiting, whether it is anxiety, frustration, or fear. Say something that recognizes that emotional state to help you move to the next step in your intervention. Now, you want to keep in mind that the emotion behind the behavior may be fueling the repetition, and addressing the emotional need may help diminish repeated questions, statements, or behaviors. Briefly answer the person's questions or address the concerns. Repeat the same answer to help the person who may be processing your words slowly and cannot retain them. You want to make use of memory aids like notes, photos, and calendars. These help for some people, though not for others. Remember that repetition is part of the disease. You want to engage the person in a purposeful activity to redirect his or her focus. Now, you want to turn the action or behavior being displayed into an activity with a positive focus. It can help to offer a repetitive activity like wiping countertops, folding towels, sorting laundry by color. Good to try to do something that the person always did throughout his or her life and enjoys doing it to maintain positive focus. You want to reassess and plan for the next time. Again, you finally ask yourself whether your new response helped. Is it working, or do you need to explore other potential causes and solutions? If so, what can you do differently? It helps to remember that this is a symptom and it is related to brain damage that comes with his or her disease progressing. Do what you can to maintain an emotional distance from the behavior. Now, this may mean teaching yourself to adopt a calm stance, using deep breathing or reciting a meaningful phrase or prayer. Do what you can do to stay centered on the thought that this reflects the disease and not the person. Expect the repetition to happen again. If you anticipate and make a plan for it, you can be prepared to handle it as well. Now, next, we're going to focus in on the issue of wandering. At some point in the course of their disease, approximately 60% of people with Alzheimer's disease or other forms of dementia will wander. And this behavior may take place without warning, so many families are unprepared. Let's take a look at Anne and Bill as they deal with incidents of Anne's wandering, and then we'll explore how taking the 4 steps again, we outlined and can help. Anne and Bill spent the early years of their marriage in New Jersey. They moved out of the state to their current home 30 years ago. Anne constantly asks to visit New Jersey. She frequently leaves the home in the morning while Bill is showering and states, "I'm going to New Jersey." She has been found by neighbors on many occasions at their church, on neighborhood streets, and one time at a very busy intersection near their home. Their daughter Katie is quite worried about potential injury, and Bill is also worried and is at a loss about what to do. Bill is logical and tries to explain to Anne the reasons they cannot visit New Jersey, though he recognizes that this approach is not working. This approach also tends to make Anne more angry, and the wandering incidents increase at those times. So let's keep Anne's situation in mind as we review the steps again. Step 1 is detect and connect. Assess who, what, when, where, and how to identify possible triggers. His or her reasons for wandering may not be logical to you. Join with the person and accept anything that the person says about his or her wandering, being goal-directed. Step 2, address the physical issues first. As always, look for pain first. Wandering sometimes begins in an attempt to move away from the pain. If the change is sudden, consult the person's doctor for an assessment. Check to see if the person may be reacting to a change or difficulty with something in his or her immediate surroundings. And have there been changes in the person's patterns of exercise or daily routine lately? Often, a person is responding to an unmet need, such as hunger, thirst, having to go to the bathroom, desire to get away from something or someone unpleasant, the desire to go home, go outside, or to engage with others. Now, you want to make any changes needed to keep the person safe as you continue your assessment. So step 3 is then address emotional needs. Is the person feeling bored or understimulated? Name the feelings that you pick up on from the person by saying something like, you seem sad, or you look scared. Provide reassurance that he or she is safe and that you are together. You really want to make them feel as comfortable as possible. And again, to know how much you care and want to be there for them. You want to reassess and plan for the next time. Plan ahead of the first wandering incident and put plans in place. If possible, help the person do what they want. If they want to go outside, grab your coats and go with them for a walk or a drive. If that's not possible, agree and delay. And sure, a walk would be great, but it's almost lunchtime. Okay, if we go after lunch? You want to create opportunities for safe wandering, such as an enclosed garden with a circular walkway. Suggest doing something physical together during times when the person is typically the most restless. Make changes to the person's surroundings that can help reduce the risk of wandering. And some ideas include putting dark mats in front of doors to make them look like holes, which the person might avoid. Camouflaging doors and door jambs by painting them the same color as the walls, and hanging towels or cloths over doorknobs to disguise them. You want to provide a structured routine for the day, and in doing so, you'll offer things for the person to plan on throughout the day and can alleviate any boredom that may trigger wandering behavior. Consider a community day program or other day structures that provide supervised activities for the person to engage in. The higher level of oversight, activity, and exercise can also provide a way for the person to discharge some energy throughout the day, which can definitely help with sleeping through the night and avoid wandering. Now that concludes the presentation. So at this time, are there any questions for us before we shift on to talking about the Alzheimer's Association?